Hi, I'm Irene, the nurse and exercise physiologist at University Health Fitness Center, located at the Texas Diabetes Institute. In this video series, I'm going to show you some basic resistance and strength training exercises that you can do around the house with items you have at home. Before we get started, here are a few rules that everyone should follow when doing any exercises. Number 1, make sure you have permission from your doctor to begin any exercise program. Number 2, immediately stop any exercise if you begin to feel chest pain, shortness of breath, or sudden pain in any part of your body. You don't need a gym membership to exercise. These are just a few items you may have around the house that you can use during this video. If you have 1 or 2 light dumbbells, great. You can also use a resistance band or 1 or 2 16-ounce bottles of water. As we go through each exercise, I'll demonstrate each movement with these items. I'll also demonstrate modifications for each movement. Keep in mind that form is more important than how much weight you can lift. Also, remember to breathe with each of these movements. We never hold our breath during these types of exercises. Now let's work on our large muscle groups, starting with our chest. I'll demonstrate 2 exercises, the chest press and the pectoral fly. Ideally, you would want to be on a bench, but we'll work with what we have. For the chest press, you'll be seated in a chair, slightly forward in the chair. You'll lean back to the back of the chair and lift dumbbells or water bottles to right in front of your shoulders. As you press out with your hands, is when you will breathe out. As you lower the weight back to in front of your shoulders is as will you breathe in. You press out and breathe in. You will do this movement 8 to 12 times. Again, a water bottle is just as acceptable. I'm going to go for the resistance band now. With the resistance band, you'll sit back into the chair, place the band on your back, and lean against it. Grab the ends of the band, hands in front of your shoulders, and press forward, using your back against the chair to hold the band behind you. Again, doing this movement 8 to 12 times, breathing out as you press forward, and inhaling as your hands come back to in front of your shoulders. Using the band for the second chest exercise, we will start with our hands in front of our body straight, elbows soft, not locked, and we will open our arms and bring them together. This is your pectoral fly. You will be doing this movement 8 to 12 times. As you bring your hands together, you will breathe out, and as you open your arms, you'll breathe in. I'm going to put the band down and get the dumbbells to show you how to do that movement with the dumbbells. Again, moving forward in your chair, leaning to the back of the chair. You press the dumbbells forward, open your arms, and as you bring your arms together, as you breathe out, and when you open your arms, you will breathe in. You will do this movement 8 to 12 times. Now let's work on another large muscle group, our back. Today we'll learn the bent row. You can perform this exercise standing or seated, so let's practice both. You can use a resistance band or dumbbells. Remember, if you don't have dumbbells, you can use water bottles. We'll start with the resistance band. You'll place your foot on the resistance band completely. You will be slightly bent at the waist. Grabbing the side of the band, you will pull your elbows back and your shoulder blades together. Lower your hands back down, lifting your elbows back, squeezing your shoulder blades, and lowering your hands. You'll do this movement 8 to 12 times. let me show you how to use the dumbbells. For this exercise, you'll have one dumbbell in each hand, bending at the waist, leaning forward, having the weight slightly in front. Again, pulling back with your elbows, squeezing your shoulder blades. This motion is as if you would be starting a lawnmower. You'll do this movement 8 to 12 times. Now let's do this movement seated. You will sit forward in the chair, bending at the waist, leaning forward. You'll place your arms down by your side, weight slightly in front. Remember, as you pull back, lifting your elbows and squeezing your shoulder blades, you will breathe out. And as you lower the weights, you will breathe in. Keep your shoulders relaxed. Lower the weight, breathe in, lift, and exhale. Now let's use the resistance band for that same exercise. Just like you did when you were standing, make sure your foot is on the band completely, grabbing the sides of the resistance band, bending at the waist slightly forward. You will lift your hands, elbows back, shoulder blades together. Doing this movement about 8 to 12 times. Remember, you can do the bent row either standing or seated, depending on how you're feeling that day, and you can use a resistance band, dumbbells, or water bottles. Strength training is an important part of our wellness and fitness. It's not about creating muscles that make you look like a bodybuilder. It's about building muscles that will help you with your day-to-day responsibilities, like lifting a laundry basket or putting cans away in a pantry, or even getting up and out of a chair or off a commode. It helps improve our balance and it can increase our metabolism. Remember to breathe with each movement. Never hold your breath. Do these exercises 2 to 3 days a week, never 2 days in a row. Focus first on good form, then adding weight or resistance. Again, remember to check with your provider before beginning any exercise program, and stop if you have chest pain, shortness of breath, dizziness, or sudden pain in any part of your body. Thank you, and be well.